Welcome to the deep dive session. This morning you already got a bird's eye view of the equality index. In this session we're going to specifically look at the share of care. Because if one thing became the image of the pandemic, it was people trying to have a Zoom call while feeding and homeschooling their children, while taking care of their grandmother who was really lonely somewhere, and also trying to get the cat out of the lunchbox. So there is some attention for the work-life balance. And we see also that after the pandemic, a lot of people are saying, why was I working 40 hours a week away from my children? I'm not sure I want to do that. While some other people are really happy that daycare facilities opened again so they can drop their children off and have a day for themselves and be a little bit productive. How has the pandemic changed the way we try to care for others, how the gender aspect of that might have shifted, and in what way is that related to the access to formal care that we know has a big impact on gender balance in informal care. We're going to talk about it, and I'm going to call forward Lina Salanos-Kaiter. You are from EIGE. Come to the stage. You get an applause. Lina, you're an expert at EIGE. This morning we already had a presentation about the index in total. You can also look at all the things on the wall there. Why do we specifically need a session for the share of care?
Yeah, thank you. Thank you everybody for being here. And also I am really happy to actually have one more session to specifically look into the unpaid care. And we would like to dedicate this session to the actions needed to change something so that this share of care actually becomes more highlighted in terms of the actions needed to reduce the gender gaps that we have in terms of the unpaid care. And as you have seen today already in Irene's and Davide's presentation, they have pointed out to a few figures that we have from our survey that we have collected in 2021. So this session I would like to explain just a little bit more, just a few more figures in addition of how this intensity of care that matters most of defining and becoming root causes of gender inequality in the other domains of gender equality index, such as work, money, power, time. So just a few more figures, but actually the most attention will go into the policy action.
The policy action, okay. Yeah, you are going to give a very short overview of the relevant figures. We're also going to test the audience if they have a little bit of a good gut feeling. After that, we're going to have a panel of a variety of experts. Why did you choose them?
We try to keep a balance of different views. We also know that unpaid care is not just care, one type. There are different types of care. We have long-term care, we have child care, we have homework. We have different stakeholders working in the field, and it was a major challenge of how to choose the speakers to come here for this still very short session, given the burden and given the challenge that we have ahead of us. So not an easy choice.
Okay. Well, we're going to get our panel on stage after your presentation. Then we're going to have 2 rounds of discussion. The first one is on the share of informal care. We know women take a much larger share of informal care than men. And maybe you're going to tell us a little bit if that's also what men want, or maybe they also want to change that. And then, secondly, we're going to talk about the access to formal care, which we know has a big impact on the first one. We're going to ask you for some policy recommendations because we want to take 3 steps forward. So we're going to ask you to come up with policy recommendations. We have a system for that. I'm going to explain to you how that works. You're going to monitor that, and we're going to see which comes out of it. But also what the panel is going to say. We have people who listen very carefully and who summarize that into the system. And if you think, this is a really good policy proposal, you can upvote them, and the 3 most upvoted policy proposals, that's how democracy works, those will be our 3 steps forward from this session. I'm going to explain to you how you can submit your policy proposals. We are going to need your phone for that, or your tablet, or your laptop, or your smartwatch, anything connected to the internet, and you go with your browser to menti.com, or you take a picture of the QR code that is going to magically appear above my head. I hope. Should be appearing. So if not, you go to Menti, here it comes. You go to menti.com, and if it asks for a code, it's 77195552. But if the pandemic had one good thing, it's that everybody knows how to use QR codes now. If I'd said it before the pandemic, then there was one tech nerd who knew it, and now everybody knows QR codes. So you take a picture of the QR code, or you go to menti.com, 77195552. And this, of course, also is for our people who are joining at home. A very warm welcome to you as well. We're also looking very much forward to hear your policy proposals. Also, you can enter them in the system so that people here and at home have the same rights. The first question we would like to ask you is, what is your gut feeling? Can we have the system back? So the first question we have to you is, so what is your feeling since the pandemic, unpaid care has become more equally shared between women and men? Do you think, yeah, probably it is? You say, yeah, slightly. You're not sure, or you think it's stable. But the overwhelming majority says either disagree or strongly disagree. So the inequalities have risen. Is the gut feeling of the audience correct, or are they way too negative?
Well, I cannot disagree with the audience. We are heading, we do have positive signs. So indeed, it's in the direction of disagree or strongly disagree with the statement that we have put forward. And my challenge today, given that you have already heard a lot from the other speakers, is actually to show you a few facts. Where do we see how it changed?
Wonderful.
And to illustrate, actually, with the facts and figures coming out from the survey, what kind of changes we observed, how intensity is changing, and what do we mean by that? What do we mean by talking about that intensity is the main factor that determines the gender gaps in unpaid care? So let's move into the first figure. You've heard this morning about 40% of women and 21% of men spending at least 4 hours per weekday caring for children under 12 years old. This is one of the main figures. Now, today, I would like to also show you another point that goes along with these figures. Actually, when we talk about intensity of care, so it's number of hours. Most of us care, but the number of hours matter most if we observe gender gaps in the related activities, such as employment, for example, if in terms of money, our capacity to earn economic resources. And one thing that we also have to look at is how people use external childcare support. So in this figure, in the table next to the main figure, I would like to show you that actually men rely on external childcare support more than women. And this is somewhat, I think, not such an often story that we hear when we think about the formal services. We typically think that formal services do help in the same way, and this is the gender perspective we would like to bring. It could be that it's because of economic resources, it could be because of the social norms, but we do observe a very consistent pattern across different types of external childcare support services, be it formal ones or also those from the grandparents, from the family, from the relatives. We do observe less women than men being able to use those. Now we would actually want to move to another type of care, long-term care, and before that, so Roger has prepared another question just to check.
Okay, so we know that of all the men who provide long-term informal care, 81%, so 4 out of 5, also has a job next to it, so they combine it both. For the women who provide long-term care, which percentage of those women are also employed? And you can use a slider from anything between 0% to 100%. And again, the men were 81%. And we see very different answers coming from the audience. A lot around 50, 40. One person thinks 100%. But most is slightly under 50%. People think, oh, there's more coming in. It's a really broad range coming in.
And this is actually the range that we expected to see. I think typically we're expecting to see a gender gap. So 81% of men who provide informal long-term care, it's a very loose concept in terms of what informal long-term care is and paid long-term care that you provide to the ill family members, to those who are unwell. Typically, knowing gender inequalities, we expect less women, and I will ask you to show the next slide that we have prepared based on the COVID survey results. 68% of women who provide informal long-term care are observed to be in the paid employment. So we have this gender gap in terms of the women and men's capacity to be in paid employment.
And is this more positive than the audience thinks, because it doesn't take all the women away from the labor market, or it makes it worse because they have so much more weight on their shoulders? Is it a positive or a negative thing?
The thing is, when we talk about women, of course, we have to think about intersectionalities. For some of them, it could be more than 68%. For some of them, for example, those with migration background, it will be much less. So I will not say if it's positive or negative. I guess the truth is somewhere in between. And as a main figure for women, we have, as our survey pointed out, in 2021, it was the gender gap of that much. So if we move to the next figure, what I really wanted to say is actually also about the toll on paid work. So we established that, yes, we actually see among the long-term carers, we have the gender pay gap in paid employment. What I wanted to bring to your attention is also that 58% of women, but 43% of men say that they are completely or mostly responsible for long-term care in their household. And why do we want to bring these figures forward today? It's actually because very often we observe in the surveys that if you ask people, and do you provide long-term care to your loved ones, to your family members, those who need it, both women and men say, yes, I do. The differences come when we look more into the details. If you ask, so actually who is the one who is providing more in your household? And then the gender gaps start appearing. In addition to that, we also know that most of those who are in caring roles, the carers, very often it's not only the long-term care. Simultaneously, we do provide also lots of other unpaid care types, one of them being childcare. So in this figure, just wanted to show you that, for example, 30% of women who are informal long-term carers also provide more than 4 hours of childcare for children who are below 12 years old. 22% of men do so. And these figures are just to show in terms of to have the feeling about the intensity of care, when we talk care as the whole thing, of what it means for women and men who are in the position of having the care duties to go through the day, to combine with the paid employment, and actually, at the end of the day, we have the toll on paid work as a result of these different realities that we face. We can move to the next slide. With that, I will actually stop showing the statistical figures, and I would like to really ask you to look into our thematic focus of the Gender Equality Index report. And my last slides will bring just the quotes of what we are placing there in the thematic report. The pandemic has led to more intense informal care demands in terms of childcare, in terms of long-term care, and housework, especially for women and particularly for those in paid employment. So yes, pandemic had different effects across the groups, but those who were most affected were those in paid employment women. We also noticed that work-life balance is a growing consideration among men. We noted with our survey that there is a higher capacity of men to combine unpaid care with paid work. It could be related to gender segregation in the labor market, to the jobs that they have, to the working schedules that they have, given their job positions. Given that higher capacity, we noted that a greater share of men actually reduce paid work hours or working schedulers to take care of children or relatives in need of care. And this is actually the positive change. So it's not all men, it's really a share of men who were able and they're moving in the direction. And this is the positive change that we would like to take forward. It's a fragile situation. It can go back, but we do observe and we need to strengthen it with all possible policy actions or other actions in order to have a behavior change out of it. My last word today would be the conclusion that we have made in thematic focus, and I really wanted to highlight it today, is that more than ever, dynamic, ambitious, and transformative public policies are needed to promote gender equal involvement in informal care and to strengthen and improve the availability of affordable quality care services. This morning we have already heard informal care and formal care. Of course, these are the two sides of the challenge that we're facing, of how we're going through our lives. And we need really cohesive, holistic approaches in order to answer the problems that we're facing in terms of how to do that our personal lives, that our working lives are merging together in a gender equal way. So thank you very much. I will stop here.
Wonderful. Thank you so much for this very brief overview, but also this very concrete call. And yeah, let's dive into this. We have a very diverse panel because we need a broad approach. Well, you have brought a broad panel of people. I'm going to call to the stage Greet Vermeulen, Reka Sefrani, Thomas Fischer, Nikki van der Gaag, and Eileen Rokar joining us online. May I invite you to the stage? Good afternoon and welcome. Find yourself a seat. Yeah, take that one. Okay, so we're going to talk to you later about in two rounds. So first about the share of informal care, and then your ideas for the share of the access to formal care. Greet Vermeulen, you're from DG Just. You're responsible for the EU care strategy. Well, I'm not going to ask you to pick a favorite country, but can you favor a favorite practice from a country that you think that's really a good example for the whole EU?
Well, it's very difficult to choose one favorite practice. I think what is important is that there is a holistic approach, that it's a combination between legislation and policy measures to try and get both women and men to be involved in care. And for that, you need to do a long way to do it.
Holistic and everybody involved. Okay.
Yeah.
Reka Safrani, you're from the EWL Purple Pact. You have a feminist approach to the economy. What is a feminist approach to the economy?
The feminist approach to the economy is actually very similar to what Greet has mentioned. It's a holistic as well as structural approach. We promote an approach, a feminist approach, which challenges the neoliberal system. It is broken, and it's not putting care as much a value at
Is a feminist
basis.
economy, is that something different than a feminist labor market?
Yes, actually, our vision of care doesn't put care in the frame of the labor market only, because care and being cared for is a basic emotional experience of our lives, and it is good for everybody, and we have a rights-based approach actually, which is more important.
Yeah. Thomas Fischer, you're from the German federal government, responsible for parental leave and other policies related to it. Without the EU, would Germany have different policies?
Probably. It's obvious because you have the Barcelona process, Barcelona targets, and you have all the directives, what's it called in English? Work-life balance directive. So this is the framework, but on the other hand, we have had a policy approach, I think since 2006, 2007, when we introduced the parents' allowance in line with entitlement to have a place in childcare and with the investment in childcare. So this is a whole package. It's a whole holistic approach that you spoke of. But that was our policy in 2007.
Okay, so it's a little bit of both. Nikki van der Gaag, you are a gender consultant for you have a lot of hats where you do that. You worked a lot to involve men and boys in unpaid care. What is the secret to get them there?
I don't think there's only one secret, but I think that's a very good question. I mean, one of the things I've been involved in is producing something called the State of the World's Fathers Report, where we've tried to look at policy actions that can change men's attitudes towards care. And we had a number of points on those policy actions, but I think that one of the overarching really important points, and it comes back to your point about a feminist economy, is that we're not starting from scratch. Feminists and feminist economists have been working on this for 20 years. We have Diane Elson, Professor Diane Elson came up with the 3 R's of care: reduce, redistribute and revalue care, and men need to play into that as well. And it's not just individual change. I think we've talked a lot today about structural change, about policy change, about change in institutions. And unless you have all those together, men aren't going to change either, and women aren't going to be able to change.
Is gender equality the goal, or also the tool to create a different way of thinking about caring?
It's a good question, and I think probably both together. I think one of the things I was going to say a bit later, but I think I'll say now, is that there are lots of examples of projects within Europe of working with men and boys on care. I think 2 or 3. So, for example, ACEV, the Mother and Child Foundation in Turkey, has been working for 2 generations. I met the 2nd generation recently of men who'd been working on care and changing their attitudes to care.
Is it something that needs policies, or just the times are changing, gender roles are fading, so we will, in the end, be more equal?
No, absolutely needs policies.
Okay,
and it needs the implementation of policies too. I can talk about that a bit more specifically later on. A lot of people have said, great to have policies, but unless they're implemented, nothing's
we're going to talk about that. Joining us online is Eileen Rocard. You're the health analyst at the Directorate for Employment, Labour and Social Affairs at the OECD. What example can you bring where the dialogue between employers and employees really made a difference?
It is a really good question. In general, really, what happens is that informal care to older people is not a recent topic, but it has really gained importance with the COVID-19 and the pandemic. And now we're starting to talk about it more and more. And so what we see now is that domestic workers, including long-term care workers, are more and more recognized. Afterwards, when it comes to social dialogue, I believe that people, employees, employers, and the states can join forces to launch regular awareness campaigns. And I'm thinking, for example, as the Carers Week in the UK. And I don't know if you've heard of the European Carers Day that is now taking place every 6th of October.
But you could say if employers and employees do their work well, they don't need the government to regulate.
Well, the informal carers are not professionals as such. So they are people like you and I. And as such, the labor market is regulated by policies, and their rights is linked to those policies. And that's why it's very important to regulate the labor markets, including by providing carers leaves and encouraging the take-up of those leaves.
Okay, very clear. Okay, we're going to discuss with you in 2 rounds. We're going to talk about what policies are needed. So we're going to hope that you're going to bring some policy recommendations. We're also going to ask that to you. For this, you will need your phone again. I see things happen in my... we're going to have a poll for the beginning of this, but also if you see below the poll that I'm asking, there's also the open Q&A. If you do that, then you can submit a question. Well, here, instead of a question, you can submit a policy proposal. And you can also upvote the ones that you see that you like. So before you submit one, check if it's already there, so we don't have duplicates. And upvote the one that you like. And maybe wait a little bit with your upvoting, because at the end of the session, we will have all of them. Because we're going to ask you to only choose 3 upvotes. So we're going to make it a little bit more difficult to you. So choose your 3 upvotes very wisely. I think you can retract them and do them for someone else. What we would like to know from you to get the first topic started. So we're going to talk about the share of informal care. Can we see the voting system on the screen? And then the question is, closing the gender gap of informal care is, well, you say it's happening. We're going fastly on the right way. We're slowly getting there, but it could use a little bit more caffeine. You could say, well, it's stagnating, it's barely moving despite all that's happening. Or you could even say it's going the wrong way, we're going backwards. Well, people aren't necessarily very enthusiastic here. We have, most people are saying we're barely moving, or some are even saying we're going the wrong way. Okay, so we're looking very much forward to your proposals. Open the Q&A below the poll, and there you can submit your proposals. and also see the other ones. And we see already the first ones are already coming up. Okay, Ms. Vermeijer, yeah, what would be your policy suggestion?
Well, I want to go back to the combination of legislation and policy measures. And the first one is that you have to create rights. I don't think the sharing of care, and particularly sharing of leaves and having working time arrangements that allow both men and women to take an equal share in their unpaid care responsibilities would really come automatically. So legislation is very important. And that's also the approach of the Commission. In 2017, we had a proposal which we called a Fresh Start, a new initiative for work-life balance, where we try to encourage family leaves and flexible working time arrangements for both men and women over the life course. And the Work-Life Balance Directive was adopted by the co-legislators, the member states and the European Parliament in 2017. Their minimum standards, Germany is going above it on some issues, other member states have different solutions, but their minimum standards on paid paternity leave, parental leave, of which 2 months are non-transferable and adequately paid, carers' leaves, and the right to request flexible working time arrangements when you have care responsibilities. So reduction of your working hours, telework, flexi time, etc. So it was adopted in 2019. Member states had until the 2nd of August this year to transpose the directive into national legislation. We are currently looking at the implementation plans. We received them. We haven't received all of them, so we sent a letter of formal notice to the countries who have only partially transposed or have not yet informed us of their measures. But it's an important step, but not sufficient. So again, we go back that we have to tackle these gender stereotypes. And I'm share with the other speakers on these panels that it's really important. And for that, the Commission will set up 2 campaigns which are important. One will be an information campaign on the leaves you have from this Work-Life Balance Directive. And a second one is on tackling gender stereotypes in different areas, including on care. It's not an all solution, but it's also complementing. So for people, it is not something so abnormal that both men and women are in care, and we really encourage both men and women to be involved in care. By the way, when we did a survey, a Eurobarometer on this, we saw that men are also interested in having care provided, having family leaves provided they're paid. So that's one element. Another one is also to try and find these kind of projects, good pilot projects, which really are trying to find new ways of doing it. And through our Citizenship, Equality, Rights and Values program, we try to sponsor some of these projects, preferably going over different member states and having different approaches. And in our new European care strategy, we're going to continue with projects on care, on the value of care, and also on detecting family-friendly workplaces which encourage both men and women to have better working time arrangements which allow better care with private lives. And then another action we will do together with Equinet, which is the umbrella organization of equality bodies, is to try and see those workers who have care. Some of them might experience unfavorable treatment or even discrimination when they take leaves. So what kind of measures at national level, through equality bodies, but maybe in collaboration with labor inspectors or trade unions, what kind of ways can you tackle these kind of treatments? And then last but not least, evidence-based policymaking. Data are crucial. Information from the situation in member states, so we're trying to follow this up. We try to also exchange good practices, and in Germany we did a mutual learning seminar with representatives from different ministries from all over the European Union in order to discuss a little bit how did they implement parental leave. And then data on the use of time on paid and unpaid work is really key, and for that I'm very grateful. We have Eurostat data, but very much complemented with in-depth data from EIGE. Congratulations on your survey. It's really interesting findings, and this really helps us to see where are some of the key points, as well as Eurofound with their surveys, where they also look at different working times arrangements in combination with unpaid work. We also want to look at the uptake of leaves, because our directive should be transposed. How many men are going, and women, are going to avail of these leaves which are created in member states? And for that, the member states have agreed on a harmonized framework in order to kind of measure uptake by men and women with care responsibilities of this. EIGE, and together with the Leave Network, they did some study on detecting which are the workers who don't have rights yet in these minimum standards. So often self-employed workers are not yet included, or workers who have too short of a track record, etc. So we want to continue monitoring this. And then doing further, we count on further gender analysis from institutions like EIGE, etc., to keep us on our toes, to see where we are going, and to try and see where are the next steps which we could do, but not only us. We need to have the involvement of all the actual actors, and I think my colleagues here can complement on more actions like that.
Wonderful,
Yeah.
we'll do that. Okay, Ali Rokar, what would you propose?
What I propose, well, what the OECD proposes. First of all, I want to say something, and it's that I've been working on long-term care for older people for about 4 to 5 years, and it's the first time ever that the LTC team is invited to a conference about gender inequalities. And I really think that the pandemic has had at least one positive consequence, and it's really to shed light on older people and their carers. And so I'm glad that today we're making informal care to older people specifically visible, and not only to children. They provide the bulk of care. Informal carers provide the bulk of care, and they may have been the most quiet providers of care for a very long time. Now, when it comes to policies, what we know is that gender inequalities is high among informal carers, is highest for those of the working age population, simply because gender inequality is highest for care to parents rather than care to spouse. So the decision between the daughters and the sons rather than between partners. And so it means that how to help those informal carers who are working. The European Commission, my colleague from the European Commission has already spoken about it, and its carers' leaves and other flexible work arrangements, for example, telework and working part-time. Nearly 2/3 of OECD countries have paid or unpaid leave, and about half offer paid leave for caring specifically to older people, which means that the other half of countries don't. And paid leaves tend to be quite restricted in terms of duration compared with unpaid leaves. And of course, we have hardly any data on the take-up of those leaves. But of course, the take-up is likely much lower for unpaid leaves. Now, when we turn to paid leaves, we know that Nordic European countries have among the most generous compensations. Belgium has the longest publicly paid leave among all OECD countries, 12 months, and it's also a country where employers can refuse to leave only on business serious grounds. So in short, those measures, care leave and other flexible arrangements, are those measures that help most informal caregivers of older people today.
Okay, wonderful. Nikki van der Graag, what would you propose?
So some of the same things as my colleagues, but I wanted to add a few really. I had 3 kind of broad ones. One of which is actually starting very young to talk to boys and girls about care. I think we've had some discussions around civic education. There isn't, as far as I know, very much out there which starts, I mean, even in kindergarten, to talk to boys about what it means to care and to talk to girls about what it means to care in a different way. And I think until we do that, until we start with that generation, it's really hard to start changing social norms much later on. So that was the first one. The second one, we've talked about parental leave, absolutely. Needs to be non-transferable, otherwise men won't take it up. It needs to be fully remunerated because the financial constraints around men working, I think was mentioned earlier this morning. If men are earning more, then it's the women who are not going to go to work. But also to ensure that men use all their allocated days. So the research that a number of organisations have done has shown that even when men have a certain number of days or weeks of parental leave when a child is born, they often don't take it up. And again, around social norms and also around financial constraints. So ensure that men do take it up, and employers have a role in that too. And then the third thing is around encouraging workplaces to promote flexible working and other practices that support men and women to be carers as well as workers. There's some really interesting projects out there which show that the skills you have as a parent, there's one in Italy called MAM, the skills you learn as a parent, multitasking, anybody who's a parent, put your hands up if you multitask, that are really useful in the workplace as well. So thinking about the skills that you need in the workplace and making them equal, the skills at home equal to the workplace skills would be my third one. And I can say a bit more about that later.
Wonderful, thank you. Thomas Fischer?
Yes, things keep to come back because I would like to concentrate on 3 steps forward. So what are my 3 steps for a more equal sharing of informal care? And the first one is actually to combat, to tackle gender stereotypes from early on, from the kindergarten and in schools, to promote the notion, the idea that caring is also for men, for boys. And institutions or days like the Boys' Day, where we try to encourage more boys to go into caring jobs, into social jobs, more so-called female jobs, are one part of the combat against gender stereotypes. That's step one. The second step is to be aware that the sharing of informal care is not just a private issue, not a private decision, because it's quite closely linked and interdependent with the sharing of paid work and how men and women participate in the labor market. So I would like to come back to the council conclusions of the German presidency in 2020, where we made conclusions, negotiated conclusions for tackling the gender pay gap. And most of the recommendations were dealing with sharing the informal care and strengthening formal care and formal care jobs and institutions. So this is the key for a better sharing of paid work as well. This is you need to be aware of this because it's not a private, just a private thing, but it's a thing for the whole economy. So it gives more strength to our arguments. And when it comes to concrete policy measures, I would like to speak about 2 measures the governing coalition wants to pick up in this legislative term. One is to strengthen the non-transferable parental leave just by 1 month, okay, but it's a one step further to say it's also normal that both parents, and mostly it's the men who do the 2 months now, and from then they will do the 3 months, I hope. So it's a small step, but it's an important step. And the other measure is to introduce an earnings replacement and a leave for long-term care. we have time off and leave policies for long-term care, but not with just like the parent allowance with an earnings replacement. This is important, I think, to get more people to do so, and even to get more men to do so.
Okay, very clear.
Yeah.
Rika Sarfani, what would you propose?
So our organization, the European Women's Lobby, together with its feminist economics working group, created the so-called Purple Pact before the pandemic. And the call in this Purple Pact is for a broader approach. And it is the care deal. Our ambition is to make decision makers realize that care is at the same level, or should be at the same level, as the Green Deal and the Digital Deal. This is the third missing pillar where we need to invest, where we need to make sure that there is a value, a bigger value, and the informal care and formal care are the two sides of the same coin. As you have mentioned before, it cannot really so when we think of which care services we use, we also have to think of gender inequalities in the labor market. So if women cannot earn enough to pay for the care of their children, for example, they cannot enter the labor market. At the same time, when men can go on parental leave, it has a transformative effect on their relationship with their children, but also on their work and relationship with their partners. What is very important in our model is to put, instead of the male breadwinner model that is really dominant in the labor market, and it assumes 40 plus years of uninterrupted labor activity, we would like to put the equal carer, equal earner model, where both partners are earning and doing the care work as well. We cannot assume that there is a gender equality in the household, when now a lot of the policies are aimed at the household itself, and women are kind of treated as the second grade by default. We think that women shouldn't be made dependent on this unequal relationship. We also call for care credits for pensions to be able to equalize the pension gap. And I would like to maybe say a warning. In this time where we are facing a turmoil of several crises, which are actually really fueled by a patriarchal society, it might have further impact on the gender care gap. It might mean that governments who are trying to save on public funds might not invest so much into care, and there is a really big threat in that. We have seen that in Belgium, for example, this has already had some negative consequences. The age of the child where you could take parental leave was up to 8, now it's down to 5, and it's also
so steps forward are not necessarily a gain forever. When you say we need a care deal, just as we need a Green Deal, that almost sounds like we have a climate crisis, we have a care crisis. I was talking to a geriatric doctor, and she said, so you want to dump your parents in a house for the elderly when they get old? No way, because we already have a shortage of caretakers. And a lot of people who are now caretakers will retire in a few years. You are going to have to take care of your parents. You have to get used to this. And you always thought, I'm going to give it to some professionals. It's not going to happen. There is going to be such a shift on how much pressure on working people will be to take care of their family members. We're not even aware of it yet. Was that very pessimistic, or is this really my future?
If I may say, I think without massive investment in care and putting the value in care, we cannot provide enough care services, and people will have to realize that this is a real need.
Okay. Well, we're going to talk about the formal care in a second. Let's see, because you got a lot of policy proposals. Our listening ears probably put them in the system. Lina, do we have a lot of good ideas and steps forward in our system?
Yes,
Yeah, the microphone is going to get on. Yeah, just keep talking.
Yes, so I actually see lots of policy proposals coming into the...
Is the microphone working? Oh, can we put Lina's microphone on? We're going to try one more time, and Elsa, I'm going to bring you a hand mic. Oh, I see many technicians now running towards you. Yeah.
Yes, so I am doing an active job here.
Oh yeah, you have to talk like a rapper in a microphone, so it doesn't...
Okay.
Yeah. Point it away from, hold it like this. Yeah, that will be fine.
Yes, so we have lots of policy solutions coming in. I saw already more than 20 and they are coming in, and I will just mention the diversity of them. It's really great. We have earmarked parental leave as a solution to take the parental leave policy forward. There are policy actions asking for special attention to boys' emotional and social skills. There are proposals about paid informal care to strengthen, about tackling toxic masculinity, about the macroeconomic policies and so on. So just mentioning a few, and I think it's really great to see so many policy proposals here on the list.
Is there someone in the audience who think, well, from all the things I heard on stage, there's some element is missing. I have a proposal that I haven't heard yet, something I want to add to this. Ooh, very few volunteers. We might have to pick some. Can you just randomly find someone? Hello, who are you? Hello, who are you?
Hello, I'm Touko.
Okay. What do you do normally?
Well, I'm the working for the National Youth Council Alliance in Finland, and I'm an equality specialist back there.
Did you hear some wise words here, or are you missing something in the conversation?
Well, I think you tackled some good questions, and maybe especially about transforming gender norms in a way that would affect men in taking more responsibility of care.
Is that a policy, something a government should be doing, or is that more something that society should do itself, and maybe not something you can regulate and that the government tells, from now on you're no longer a bigot?
Yeah, I think it's also a policy question, like something you could promote from kindergarten and from the educational system as well. Okay, can you get the microphone? Oh, there's a volunteer. Hello.
Hi, thank you. Good afternoon. My name is Daniela Gasparikova. I'm from United Nations Development Programme. I'm currently based in Montenegro. One angle and dimension that I haven't heard when we talk about the care and care economy is self-care. And I think it very much relates to the earlier findings of the Gender Equality Index, because women are spending so much time on caring for somebody else. There is not enough time in a day left for them to take care of themselves. Given that they live longer lives, they do not necessarily live healthier, long lives. So in the policy mix that is being considered currently, to what extent, and especially in light of the future or unfolding care crisis, how is this being factored in? Is it a consideration? And if yes, are there any good practices out there?
So basically, for every 5 days you care for someone else, you also need a few hours to process, a few days maybe even, to process it for yourself. This triggered a reaction from you.
Thank you. My name is Višnja Bacanović, and I'm coming from Serbia and wanted to share one example of innovative and transformative service produced and implemented by women's organization in rural areas, aimed first of all to self-care. Its composite includes 8 different services, and we advocate for that to be funded from the budget, of course, at the local level. But it includes also get rest, get informed, and things like that. And this has the bigger impact on the quality of life, and actually this kind of social inclusion of women and their free time and quality of life etc., than to the reduction of the unpaid work, which was the first intention. But this is, I think, interesting example that we should maybe work on different aspects of life, not only care, and to get to the objectives related to care reduction.
Okay,
care
very
work.
good. And
Thank
also,
you.
if you put it in the economic equation, if people take well care of themselves, in the end, you might even earn it back, because a burnout is also very expensive in the economy.
Thank you. I'm Anna Zobnina, European Network of Migrant Women. I would like to draw the attention of the aspect of care which is done by migrant women. And by migrant women, I do not only mean the European Commission definition, which is third country nationals legally residing in the European Union, but also intra-EU migrants. So we have a lot of women who are migrating from poorer regions of Europe to the welfare to provide care, like in Germany or in Italy. And then additionally, the women who come from outside of the European Union. And I think it's an extremely important aspect, and also where care work links with domestic work. And this also, I didn't hear much about that. And I draw everyone's attention that we can use the laws on sex discrimination that are strong in the EU.
What should be the consequence of the policies? How should it change current practices?
Well,
do you want to ban? Shouldn't we no longer allow it, or make sure these people get paid fairly, or also that they're...
This is what I wanted to say, that if we apply sex discrimination laws, first of all, if we expand labor laws to cover the sectors of care and domestic work, which is not currently regulated by labor law, they're regulated by migration policies, those women are excluded from the labor regulations. And secondly, the application of sex discrimination in employment in relation to domestic and care workers, which can be, we can take cases to court.
And this is really where, it's also a nice bridge for our next topic, this is really where informal care and formal care really start to hit each other. Okay, well, these are some, a quick one from you, yeah.
Hi, Helena Valas from Slovenia, Ministry of Labor. I was at a round table a week ago talking to rural women, and I was also talking about policies of informal care. And what I got back was they want to be paid for informal care. All the women that don't have other labor arrangements want to be paid. And that was their policy recommendation.
And do you agree with that? Or?
Well, talking to them, yes, I do, actually.
Okay. We should more see informal care also as a job. Okay. Well, let's make the bridge from this topic to the formal care, because it's coming in. Formal care is so important to talk when we talk about informal care. Here we're going to ask you the same poll question as we did with the previous round. Since the pandemic, what do you think has happened, or what is the current way we're going? Do you think the access to formal care? Can we see the system? The access to formal care is improving, or here it comes. Yeah, it's happening. It's slowly getting there, it's barely moving, or it's going the wrong way. And see if you can answer some of these. Some more questions, more are coming in. Ooh, and this is even, the first votes are coming in, and it's even a less optimistic image than the last one. So access to formal care, a lot of people even saying it's going the wrong way. And barely moving is now coming. Barely moving is slightly slower than the moving parts. Yeah, okay, but so also here it's clear no one is saying this is going exactly how, no extra policy is needed because we're going there. Some people say we're slowly getting there, but it needs some extra attention, but most people say it's either barely moving or even moving barely backwards. We have a little bit less time for this round if you want to make time for coffee, so I'm going to ask you to have brief interventions, but also here, we'd like to hear your policy proposals in this field. I'm going to change the order a little bit. Rika Safrani, what would you propose?
Thank you. So along the similar lines, as I have said before, the care deal, our holistic approach, is addressing this third missing pillar in our thinking about the future and sustainability. We think that valuing care and putting care in there is just as crucial as thinking about other areas of the economy. This is why there are massive investments needed into care throughout EU funding mechanisms, notably the Recovery and Resilience Funds, the Next Generation EU package. It's about investing into the future. I would like to recall the structural funds and the multi-annual financial framework. We would like to see that in the next cycle of that, there is this missing pillar there. The absence of gender mainstreaming and gender budgeting, which are European policies but are missing from the approach at the moment, are very, very crucial. We think that the situation is more piecemeal at the moment. We see that there is a European care strategy, which is what we really welcome, but it's a good first step towards a care deal, a bigger package where we take political responsibility for these issues and the structural perspective. The same about the work-life balance directive, where we see that the transposition of it is lagging behind, unfortunately, at the moment. And I would like to reflect on my colleague's remark. In the absence of a structural approach to care, there is the danger of reproducing inequalities and among women, particularly migrant women and domestic workers who are filling in the care gaps. And these will continue to persist, and it will actually increase and also cause a so-called care drain in their countries of origin, where they recreate these problems. So the formal care services will be, as well as the informal care services, will be lacking there. And we would like to say that it's very, very important to address the role of our insurance-based systems that propel these cycle of inequalities.
That's wonderful. Thomas Fischer, what would you propose?
Formal care, you can't have formal care without enough skilled labor force. So the proposal, or what is necessary, is to get more people into care educations, to make education more attractive. In Germany, it has been with school fees. You had to pay to enter this education. We abolished that. So no school fees, but to get a compensation for during your education and training for the job. Makes the jobs more attractive, makes the education more attractive for young men who we need in this
But
job.
during the pandemic, I volunteered a little bit in a house for elderly, and I saw how people had to work there. Even if I got my school fees for free,
that's what
is a...
that should be my next point, because long-term care is a job with. You have to address some health issues, and you have to improve working conditions. You have to improve personnel keys. How many staff are working on how many persons to be cared for. You have to improve working conditions, and you have to improve the wages. You have to have more collective bargaining agreements in this field. And there's one point I wanted to add, because the issue of domestic work has been addressed. We need, throughout Europe, Germany has ratified it, but throughout Europe we have to ratify and to implement the ILO Convention on Decent Work for Domestic Workers, 189. When I came here yesterday, I walked around in some streets in Brussels, and I saw a car with a sign, Titre Service. You have this, in Belgium, you have this wonderful voucher system for domestic work, and it's one way and one quite effective way to improve also working conditions.
Okay.
Not everything is golden in this field, but it's a better way than to have this labor market in the shadow.
Yes.
So.
Okay, Anil Kar, I saw you nodding.
Yes, indeed, about the ILO and the domestic workers, right? Indeed, it's very important, and I think that the Spanish example is I don't know if you saw, but the unions in particular and social dialogue really helped to protect better domestic workers in Spain, and the case about the fact that those domestic workers are female, are women, working in households with that are not necessarily well monitored. It was something it's something quite new. So I completely agree, and actually ratifying this 189 convention of the ILO is one of the points of the European Care Strategy.
Okay, wonderful. Nikki van der Gaag.
Yeah, so many great questions from the audience. Thank you very much. We could spend a very long time talking about them. I just want to make 3 points, I think. One is there's a continuum between informal and formal care. They're not two separate things. So we really do need to look at the whole thing in the round. And in the same way, the person who talked about self-care, it seems to me that care, we're thinking about care quite narrowly. Actually, you could look at self-care at one end and care for the planet at the other. And I think we need to have that whole continuum in mind when we're talking about care. We need to value care more. And I always think about that example of, men who become chefs are suddenly terribly important and paid lots of money. If we could change care so that men value care in the same way that they value other things, then the whole world would change completely. So let's think about that. And the third thing, we're in Europe here, but I think there's we live in such an international world. We're talking about migration. There's a lot we can learn from the global south. So for example, in Uruguay, there's a really interesting initiative started in 2015, which is a national care system that looks at both informal and formal care and looks at a kind of it's a co-created system between civil society and government. And I think we need to try and think about how we can work together more, social justice, gender equality, climate change people. If we don't all come together, we're facing huge problems. If we don't all come together, then we aren't going to be able to change things.
Okay, wonderful. And the Commission.
Yeah, I think what I hear and what we also think is that we really should step away from seeing care as a cost, care services as a cost. We have already identified the whole day long that they're key services, not only for women's labor market participation, but also for the quality of life of individuals over the life course. And I think this is why the Commission adopted the European Care Strategy on the 7th of September of this year, trying to look at both care recipients and caregivers, both formal and informal, and tapping into sustainable working conditions for formal care workers, sharing of care between informal care workers, but also the interest of care recipients. And for instance, for early childhood education and care, for childcare services for small children before they go to primary school, it's not only about, we kind of have targets on childcare participation. So we want to make sure that member states make sure that services are available, but we went one step further and we really say we also look at intensity, so there are sufficient numbers of hours, a legal entitlement when the adequately paid parental leave is over, but also look very much at accessibility, affordability, and quality. Because if the services are not of good quality, parents will not trust their children to go. Also, working conditions of those working in these services are probably not so good either. If you have a staff child ratio which is too high, it's very difficult to give good service. The same example as my German neighbor gave. It's really important that to make sure that there is sufficient staff available. So it's really about trying to look at it as a kind of investment rather than a cost, and trying to make sure that you see it like that. And for that, co-funding is available. I think the European Women's Lobby already mentioned it. Co-funding is available from European funds, and it was very clear in the Recovery and Resilience Facility, several member states used the funding used money to kind of invest in early childhood education and care, in long-term care services, because they felt the dear need that more services were needed. But we need to continue doing that, and I think it's really to discuss with the member states how to do it best. At the moment, there are 2 proposals for Council recommendations which are being discussed, and the Czech presidency is really trying to go relatively quick on it. It's a proposal for a Council recommendation on long-term care, trying to get a quality framework, and a proposal for the revision, for a Council recommendation on the revision of the Barcelona target in this holistic approach, not only looking at target itself, but also combined with the other elements. So it's a step forward. I think we all realize it's important to do it. It's trying to tap on all these things. You cannot do one. You cannot have only availability without quality, because then it doesn't work. You need to also take into account specific needs of children from disadvantaged backgrounds. They might need special measures to make these services accessible for them. We want to also bridge the gap between children at risk of poverty or social exclusion and the overall population. We know that these children often benefit more from early childhood education and care, so let's try to reach that gap. So we want to do it all, but it is a slow process, and I think there I fully understand the statistic. It's going quite slowly, and we also now realize with all the global challenges we have at the moment, with also the energy crisis, the measures at the moment, it is very difficult to invest in those things. But if we don't do it, what is the alternative? Is that we kind of have a labor market which is only consisting of half of the population, because the other half is caring at home, which is very, very valuable, but which kind of also which make it economically very difficult as well. So we want to have a kind of a balanced approach, and we really need to kind of embrace it as an investment rather than a kind of a pure cost. And
how much of a choice are things going to be in the future? If I want to take care of my parents, I can do it. If I don't want it, I can outsource it. It's all about my personal preference. Or do we have to say as a society, this is a bit how it's going to be, because we can't afford everything?
Well, we are trying to have one parameter in there, affordability. So we're trying to make sure that member states also reflect on measures to make it affordable, and not only for those with the highest kind of at risk of poverty or social exclusion, but make it affordable for everybody. Of course, it's a long way from being there, so we want to make sure. But that combined, maybe also with flexible working time arrangement, maybe certain things you can do, combining with work and having these working time arrangements which allow you to combine both.
Allow it. Okay. Yeah, Lina, we're in the last 2 minutes of this session. I see more than 30 policy proposals have come in. What is our top 3? And maybe we can also have them on the screen. Yeah.
So just to say yes, I think the first part is that we have so many policy proposals. It's really great. It's important. I will just maybe mention, let's say, those that have received lots of votes, and I would like to read them as they are, because I think every word matters. So the first one was that it has received quite many votes, is earmark parental leave. So all parents take equal leave in order to close the pay gap. Otherwise, men will continue to be considered a stable workforce. So we have lots of things, lots of dimensions that are made into this proposal. We also have another proposal which is placed forward, which is free and accessible care facilities. And I think it really takes a step forward in terms of what has been discussed. So make it affordable, but really in a quite large step forward from what we have now. And one more is implementing special attention to boys' emotional and social skills all the way from kindergarten to pave way for more engaging fatherhood in the future. And I will stop it here, and just a very short comment from my side. I think we have indeed policy solutions for formal care, and I'm very happy that also social norms, so changing attitudes, special attention to things that underlie social norms, have made it to the very top 3 from the audience, both here and also from outside. Thank you.
Wonderful. Rick Safrani, you started with an economy, a feminist economy should also be a less money-driven economy. We have much wider. A lot of proposals we see, of course, we have to, one was coming in, tackle toxic masculinity. Those are the cultural ones, but most is pay people in formal care better, so more people want to do it, and pay people who do informal care for others or themselves, make it financially possible for them. Is it in the end just a matter of affordability and having enough money for it, or should we really change our perspective?
I think it's very, very important to see the value in care. If anything, the pandemic has shown us this, that it's invaluable to be provided good care, and it's part of our humanity. It is very important to have a very long-term approach to this. So what we do for our children now, by providing free and well-accessible care, is not only helping them pay back the Next Generation EU package, for example. So it's an actual investment into the future, and we should really have a long-term approach to this.
Okay, if we invest money, we get money back, but also we get a lot of value back, and that's maybe even more important. Thank you very much. Lina, what can we expect of EIGE in the future, the near future, to support all the policymakers who want to make these policies better? What can they expect from you?
I think from our side, I can promise we will keep continuing collecting data. We will bring evidence forward. And I think also what's important to take is from today's forum, from today's campaign, 3 steps forward is we can reflect, all of us, on the policy solutions that have been placed forward, all of them, and actually think of what is my take from it, of how can I contribute to it. So I think that would be the best step forward for us as the audience here.
Let's step forward, and we're going to print all 32 recommendations, send them to you so you can implement them by next week, more or less. Yeah. This was our session. We have I'm not even sure. Well, check your program, what's going to be next. But not after we give a big round of applause to Greet Vermeijlen, Reke Safrani, Thomas Fischer, Nikki van der Gaag, Elijn Rokaar, and of course, Lina. Thank you very much.